What about the role of stress? So, stress is a major player in weight gain and it affects the stress hormone cortisol. In the old days, cortisol was used to activate the body, so it would pump out blood glucose. And that was because it was part of this so called fight or flight response. If you were running away from a lion, for example, your body would pump up your levels of cortisol and you would flood the body with glucose and you would have energy, a quick burst of energy to run away. So you'd either get away from the lion or you'd be dead. Either way, the stress is over and your cortisol levels should go down. However, that's not what happens in modern society. What happens now is that we have stress, for example, marital stress or not enough money, you have debt or whatever, and that stress never goes away. So day after day after day, your stress hormone is activated and it never goes down. And that's not the way the human body was built. We're built for a quick burst of energy and then cortisol goes back down. But in modern day society, it stays up. So the blood glucose stays up, which forces the insulin to go up with it and causes a lot of hyperinsulinemia, which then can cause a lot of obesity down the line. So stress is a much more difficult thing, obviously, because there's no simple answer to trying to reduce stress. There are lots of different stress-reducing activities. So you can't do anything often about the stressor, but you can control to some extent your body's reaction to the stress, which are things such as meditation, yoga, sometimes acupuncture. Some people use religion, mindfulness meditation, proper sleep, and also community. When people are in a community, for example, their stress levels tend to go down. That is, if you have a friend or you have support from your family, then life is generally easier to deal with and your stress response is not so high.